She was crying with her mother.
Yeah.
Both of them were crying. They're
Yeah.
holding their hand. Maybe around 100 cases per day.
Wow.
Yeah, it's like a factory, like a vending machine. You put
Yeah.
something inside and then it comes out.
So they're already like 55 kilograms or something
No,
like that.
no. 55 is fat.
Oh.
43.
In my life, I never heard anybody say, nice forehead, you know? What is that?
Yeah, people died. People had necrosis.
Anyway, yeah, welcome. We just met outside and I'm super happy to have you in. I was thinking before coming, I was like, how long has the doctor been doing plastic surgery? Because I think that's the first segue that I thought can really fit into the conversation.
Actually, I started with 2002.
2002, so I was 11. Wow. 11, so what's that, 24 years?
Yeah, 24 years.
That's
Yeah,
a very long
it's been a
time.
long time.
But you
yes.
haven't always done it in Korea.
Yeah, I went to a lot of places. Usually to China.
Okay.
Yeah, I've been to many cities in China, and Philippines, Thailand,
Did you used to work in the
Taiwan.
Middle East also?
Middle East. I went there a few times.
Okay.
But, I had some difficulties there.
I see.
Yeah.
Was it a language or more of a cultural difference?
No. Actually, the visa problem was the biggest one.
I
Yeah.
see.
Yeah.
I actually watched a
And-
video today and yesterday, and they said the most difficult passport to get are the countries in the Middle East. You have 25 years. 25 years you have to live there.
Oh.
So yeah, I understand the visa thing.
You know, in the Middle East, I have been to a few places like UAE, Kuwait, Saudi Arabia, and Saudi Arabia. It took me about 1.5 years to have the visiting visa.
Visiting visa.
Yes,
Wow.
I went there for 2 days.
Wow. And it took 1.5 years.
Yes.
And when was
You know
this?
how much it cost to get the visa?
How much?
It was something like 90만 원.
Like almost $1,000. I guess that time.
Yeah. At that time, it's about $800.
That's crazy.
Yeah, just for a visiting visa.
Just for and that was just what were you visiting for? Like for a
Actually, I was invited by the company
Mm-hmm.
doing the liposuction.
Yeah.
Yeah, they were selling the ultrasound machine,
Yeah.
and I went there to give a lecture, and that's it.
So
that was the reason.
They invited you, and you
Yes.
still had to pay $800 and wait a year and a half.
Actually, I was not the one to pay, but
But you still
the
had to
company
pay.
had to pay $800.
Wow.
To the embassy
Yeah.
and to the. I'm not sure how much the embassy is charging,
Yeah,
but
yeah.
the agency was asking for
How to
$800.
organize it? Wow.
Yeah.
And have you done this kind of liposuction conferences? You've done them quite a lot because I remember when I met you
yes.
6 years ago, you used to tell me you would always go everywhere for them.
Right. We went to. Actually, I've been to almost like 50 cities in the world.
50 cities, and just all for purely.
Usually for lectures.
Really?
Yes. Yeah.
So
around
the
the
lecture
world.
is usually like 1 or 2 days.
So the last time I went to Italy,
Mm-hmm.
it was 3 days, 1 night.
So
I
it's
just
just
go
work.
there and then give a talk and then come back.
Wow.
Going back and forth takes 2 days.
2 days, yeah.
Yeah, and then I sleep 1 day and then come back.
So no downtime, no holiday,
no, nothing.
no checking the
nothing,
sites,
yeah.
just work.
Yeah.
That is
I went to New York 3 days too.
in even New York.
Yeah.
Oh, that's too much koseng. That's too much hard work.
Yeah, because I've been to many places, but there are many cities there in the world where I have been to only for 1 or 2 days,
And all because of work.
yeah.
Yeah, you are. I mean, even the time I met you, I remember one of the first thing I thought to myself after speaking to you is, this man works a lot. Like you're a workaholic.
Yeah, I was really a workaholic, but past about 2 years,
Mm-hmm.
I've set my mind that within my schedule, I'm going to put inside rest.
You're gonna
Before
make
there
time.
was no such thing as rest.
Yeah, it didn't exist, right?
Yes, I've been working almost every day until Sunday, and if I'm not doing something, I needed to do something,
Yeah,
But nowadays, I spend few hours not doing anything.
I see.
Yeah,
So you're allocating some time for yourself.
yeah.
So you've traveled to all these countries over all these years that
Mhm.
you've now been in the industry. How has it changed for you since you started in, let's say, 2002 versus where we are now in 2026, 24 years? How much is the plastic surgery landscape changed?
Actually, in Korea, the plastic surgery industry is very, very competitive. So within the 2 kilometers in Gangnam area, we have about 700 plastic surgery clinics.
In 2 kilometers.
Yes, in
Wow.
diameter of 2 kilometers.
Yeah.
Yeah, we have 700. So how do you survive? That's very difficult.
Yeah.
Yeah. So people, the doctors, doctors focus on only just one thing,
So they
one
specialize.
kind of surgery.
Okay.
Right. Yeah. So you specialize in very subspecialty. So I do liposuction and abdominoplasty, stem cell treatments like that. But before, when I was younger, I used to do this and that. But nowadays, I focus only on liposculpture. Actually, not just liposuction per se, but I usually do a lot of liposculpture, making 6 abs,
Mm-hmm.
11 lines on the for female.
Yeah.
Yeah, those things, complicated things. I do a lot of resurgeries.
And before that, you were so
I was like other young doctors.
yeah, because
yes.
there are some just for the people that don't know, like there are clinics like yours which are very specialized,
Right.
and then there are clinics that you can go to, and there will be a doctor who can do or who does rhinoplasty, blepharoplasty,
Yeah.
breast augmentation, liposuction. Or they'll have all the doctors one that does everything, right? They're kind of the big clinics.
Right.
And then you're the type of clinic that specialize, right?
Yeah. So in Korea, there is a we call factory clinics, which means there are a lot of doctors, 10, 20, 30 plastic surgeons in one clinic doing everything. You're right. But the senior doctor is there, old as I or a little bit younger or something like that. But he's governing all these young doctors. So they do maybe around 100 cases per day.
Wow.
100 cases per day.
Wow.
Right.
And that's including everything. So they'll have
Right. Somebody is doing the eye, somebody is doing the nose.
see.
Yeah, it's like a factory. You put like a vending machine. You put something inside and then it comes out.
So, new nose, A to B. Wow, but that's amazing because I mean, for me, before I came to Korea, I didn't know that this world existed, right? And then coming to Korea 10 years ago, and then getting involved in the industry briefly, I realized, well, there's this whole other side that we didn't know. So when I think about the factory, I think about exactly like you said, a place that has a lot of doctors where you see the patients like in and out. I guess that's where the factory analogy comes from, right? There must be a specific target group that find those clinics more appropriate for them as opposed to like a specialized clinic. What is the difference between someone that runs a clinic like yours or somebody who wants to go to like
actually surgery is something that a doctor does, not the clinic actually.
Right.
So it is who is going to perform the surgery. That is the important thing.
Right.
So if you go to a big clinic, you will find a lot of doctors who are young and experience less than 5 years mostly.
Okay, so they're newer.
Or 10.
Well, so 10 years is still considered not very experienced, like
No.
middle. Wow.
5 years. There is a textbook
Yeah.
saying like textbook about the breast surgery,
Mm-hmm.
breast augmentation.
Yeah.
It says there, uh, new doctors such as less than 5 years of experience.
Wow.
Yeah. So 5 years of experience are just
New.
new
Yeah.
doctors with minimal experience.
Right.
So 10 years, you know what? I tell you this. I was suturing. I had about experience of 10 years.
Yeah.
And then suddenly I felt like, oh, I have to do this way, not the way I've been doing for 10 years.
Yeah.
After another 10 years, I found something new.
Wow. So you're always evolving.
Yeah, but it takes about 10 years to evolve.
Wow.
Right.
Yeah. So the bigger clinics then, it's not that the surgeries or the doctors are worse. It's just that they're more inexperienced. So would that mean that they're cheaper?
Yeah, they're cheaper.
Okay, so that
Yeah.
for somebody who doesn't have a big budget but does want to get surgery, those bigger clinics offer a
Yeah.
bigger variety with budget, right?
Right.
Whereas with your clinic, with your experience now,
Yeah.
because as far as I know, you only do one surgery per day.
Yeah, I do only one long surgeries or two short surgeries.
I see.
Yeah.
So what is
that's it.
considered a long surgery?
Like doing abdominoplasties, it takes about 5 hours or longer.
Okay.
Yeah, if the patient does this and that
Mm-hmm.
together with the abdominoplasty, it takes longer.
I see.
So it's the whole day.
Yeah.
I can't do anything else.
And you're just there.
Yeah.
Like hands of a surgeon. The
Right.
real hands of a surgeon.
Yeah.
Just how do you feel in that moment? Like I always wonder, like for me it's difficult to sit still for an hour. I can't imagine just to be like completely focused on this one task for like 8 hours. Are you focused, or do you sometimes feel like you drift off, or you're just like completely in the zone?
Actually, the cleaner, anti-cleaner in our clinic,
Yeah.
she says to our nurses, why is it so noisy inside the surgery room? Everybody's laughing and sometimes talking loud. Yeah.
Just want to say quick thanks to the sponsors, because without them, I won't be able to do this podcast. 저희 팟캐스트 메인 스폰서 프리덤에 감사를 인사드립니다. 프리덤 없이 저희 이런 팟캐스트 진행하지 못했을 겁니다. 프리덤 지원하려고 하면 그 제 디스크립션 모든 링크 확인해 주시고, 그리고 온라인 스토어도 이런 멋있는 옷 구매할 수 있습니다. 아니면은 오프라인 스토어 압구정에서 방문하러 가도 됩니다. 프리덤 많이 응원해 주세요. 프리덤, thanks for the support.
So in my surgery room, we always are focused, but we are always like a little bit crazy people,
Yeah.
laughing all the time,
yeah.
and they're talking happy
Yeah.
things.
Do you
I
feel
think
that?
this is important.
Yeah.
If you're focused like that, and then you're doing it, you might think it's better,
Yeah.
but you have to be in up mood.
Mm.
I don't want to be like low mood.
Down,
when,
yeah.
I don't want that while doing the surgery.
I see.
I want to be in not high like that,
Yeah.
just a little bit like that.
Were you always like that, or
joyful?
exactly like enjoying the work, right?
Right.
Were you always in that state of mind, or is that also something that developed throughout time?
Yes, it has developed. Let's say I have a new nurse.
Mm-hmm.
I think it takes about a year for a new nurse to fit into our team.
Okay.
Usually who has experience of 20 years or something like that. A nurse of 20 years of experience
Yeah.
comes to my surgery room, and then she works for the first time. It takes about a year to be able to laugh
I
and
see.
enjoy what she's
Just to
doing.
like be able to feel like she's under a lot of pressure. Just be
Yeah.
like, oh, I'm comfortable here.
Right.
Is it because they feel the need to be really perfect at their job, or they're stressed to impress you, or
No. It's like after about a year, you are relaxed. You know what you have to do.
you know your
Yeah,
role, and you're
yes.
confident in yourself.
Right.
I see.
Otherwise, I don't let them do much.
Mm,
You just watch.
I see.
If you come, for about a month. I just pay her to just
Observe.
just to observe.
Wow.
That's it.
Wow.
Yeah, I don't let her do anything.
I guess that makes sense because the risk to reward is so high. Like if you allow someone to prematurely get involved with the surgery,
Yes.
the risk is too big to allow them to do that. You
Yeah.
have to be confident that they are competent
Right.
to go ahead and then assist
Right.
you the way
Exactly.
they need to, right?
Exactly.
I guess that's the same why you need doctors that have been training for a decade just to start
Yeah.
to start even being allowed in the clinics, and then
Right.
5 to 10 more years to then be considered not completely a rookie or a newbie.
Right.
So your surgery that's a pretty complicated procedure, the liposculpture.
Right.
So I think most people know liposuction. It's just I have this idea in my head of this thing that's like just sucking out the fat, but I guess that's what people understand liposuction to be.
Right.
What is? Am I right in assuming that? And what is the next step, which is liposculpture? What is the thing that you do?
Okay, let me explain it to you very easily.
Mm-hmm.
Liposuction is like you are going to suck out some unwanted fat, some unwanted accumulated fat in certain areas of the body. Like if you have belly bulging out, we take out the fat. The aim of the doctor is to take out it very smoothly, round, and no undulations. They don't want to end up with any undulations like that. So they want to make it very flat. That's the aim of the surgeon. But in the term of liposculpture, we are going to do the sculpting. Like sculpting, here I take out a little bit more. Here I take out a little bit less. And then I through the design that I put on a patient, we make 6 packs to have the burrows.
Yeah.
Yeah, and then it looks like a real one.
Yeah.
You can't tell.
Yeah.
You can't tell. When I do surgery, you can't tell if it's a real one or not.
I have seen your photo. I remember the first time I saw a photo, I was like, this was 6 years ago, and I looked at it and I thought, okay, this is AI. Not even AI. That time, this is Photoshop.
There was no AI.
There was no AI. I was like, this is Photoshop. And then I remember meeting one of the patients and actually seeing the after and thinking, this is insane. How is this possible? This is absolute magic. I thought you were a wizard and not a doctor. It was crazy for me to see it because I always thought that it's just to I can't get rid of this fat, so I want to remove it, whether it be my stomach or my legs. But for you, you're like not only removing the fat, but now sculpting the body that the person wants. So it's not anybody that can do that, right?
Yeah,
How do you go from being a liposuction doctor to then leveling up?
Actually, there aren't many doctors who are doing liposculpture. Actually, there are some. Yeah, but
in Korea or the world?
Yeah, in the world.
Wow.
Yeah, there are some people. But actually, it's very easy. You take out a little bit more here, then you have less. Here, you leave a little bit.
Yeah.
That per se is not that difficult.
Yeah.
But doing it artistically is another thing.
For it to actually look real and normal. Yeah.
Yes, that's the difficult thing. And one thing is what makes difficult is that when you are doing liposuction, let's say you're doing a sculpture, you are looking at it and then doing the sculpture. I'm doing it like this. Oh, I need a little bit more here, like that. But here, when you're doing liposuction, you have the skin on the top, so you cannot see what's happening inside.
I see.
Everything has to be in mind, and like my left hand is like ultrasound guided. So I touch it, I know where what's happening inside.
You're feeling it.
Yes, I'm feeling it.
Wow.
Yeah. So I need a little bit more like that. I cannot change my hand like this.
Yeah.
Because when I use my left hand, I can do this.
Yeah.
But my right hand cannot feel it.
Oh, you've trained the hand.
Not like left hand.
Yeah.
Yes.
Yeah. So the intuition is there, just I guess over decades of just like feeling the body and knowing exactly, because our tactile sense is so amazingly acute that I think if you've trained that sense to be like to be able to discern how much fat is where on the body, right?
Yeah. So that's how we achieve it. Another thing is how many scars are you going to make?
Okay. So usually, if let's say I'm not the best, but I'm not inexperienced. I'm just a normal plastic surgeon,
Mhm.
normal liposuction doctor. How many scars would I have, and where would they be?
This is the sixth step you want to make, okay? Then I've seen some doctors who make incisions 1, 2, 3, 4, 5, 6, 7, 8.
On the abdomen.
Yeah,
Wow.
yeah. As a Caucasian, even you
Yeah.
will end up with scars, which
Okay.
is not visible like Asians.
Yeah.
But Asians, leave very vivid scar.
Compared to Caucasians.
Right.
Okay.
So people are super sensitive about the scars.
Mhm.
So we need to hide it.
I see.
Let me tell you, when I do the liposuction of the thighs, I make one incision in the belly button.
Okay.
I make the incision inside the belly button so that you cannot see it from the outside.
Yeah.
And I make another incision at the coccyx.
Okay.
So there is only 2.
Yeah.
That's it.
And they're almost imperceptible. You can't even see them.
Yeah, you can't even see that because I make it inside the wrinkle
Yeah.
at the back. So not on the back,
Yeah.
I make it very, very low. Yeah.
Mm.
So when I suture it, it just leaves a line within the wrinkle.
Yeah.
So you cannot really see it.
Wow. So
So
normal doctors, where do they put it then?
they make 2 on the bikini line
Yeah.
and 2 on the at the gluteal line.
Okay.
They make another 2. So that's the minimal incisions that they make. Some people will need on the 2 on the lateral side of the thighs.
So why don't they copy your method? If that is way better, why don't they do what you do?
No, I
Is it a
have shown
skill-
this
a skill
skill
issue?
to some young doctors, and they all go back and try. They can't.
It's too difficult.
Yeah. It's
Ah,
like when I give you chapsticks
Yeah.
at first,
Yeah.
it's difficult to learn.
Yeah. Yeah.
Right?
Eating like this.
Yeah, you can't do
Exactly.
it.
Even when I try my left hand now, I
Uh-huh.
can't. Yeah.
But when I do the thigh liposuction, I'm using a 60 centimeter long cannula. Usually, the doctors that they use is 28 centimeters,
So it's like double.
more than
Yeah.
because I'm using 60 centimeter.
Yeah.
So this is a long one. So
Yeah.
from the belly button, I go down there.
Wow. So you're like this far away when
Right.
you're sucking.
Yeah. So, but it's also curved.
Okay.
So it's going like this, and then like that, and then go down like this
Yeah.
to reach there.
Yeah.
So this is why it's difficult.
Yeah.
So if you are using the straight one, you will need to make a lot of holes.
Okay.
Even if you are using a long one,
Yeah.
you need several incisions. But because I'm using a curved one, I
Mhm.
can go this way like that. So I can go to the lateral side of the thighs, anterior side, posterior side, all like this way.
Oh, but that it seems quite on the body. It seems like the body has to endure a lot of punishment as compared to like another plastic surgery like a rhinoplasty, where it's just
Mm.
changing a movement of the nose, maybe a little bit of filing. But when you get liposuction or liposculpture, the cannula is it going like breaking the skin entirely in the body where it's moving to against?
Not the skin, but the subcutaneous fat.
Okay.
So there is a skin, and you have the
Yeah.
fatty tissue, and then you have the muscle
Okay.
underneath. So I am to just move around the fatty area only.
I see. Does that cause a lot? It does cause a lot of damage to the body
Yes.
in that. So that's why liposuction patients are usually very bruised because there's a lot of movement, right?
Mhm.
Bigger surface area.
Actually, during the liposuction,
Mhm.
You can have some blood coming out.
Okay.
Actually, in the history of liposuction, at the first,
Yeah.
when they did, they made a lot of disasters.
I can imagine in the beginning.
Yes,
Yeah.
in the beginning.
Yeah.
Yeah, people died, people had necrosis, and after all the other things
What
like
is
that.
necrosis?
Necrosis, dying of the tissue dies.
Oh, the tissue just dies.
Yeah, right.
Jeez.
Yeah. And some people die because of the bleeding.
Okay.
But one day, there was a doctor in the States, Dr. Klein, who made the Klein solution, which is the tumescent solution,
Okay.
which contains a vasoconstrictive agent and local anesthetic drug.
Mm-hmm.
So it constricts the blood vessels. So the blood bleeding is not so much.
Mm.
Yeah. So we make tumescent comes from the word to swell.
Okay.
Okay. So this is the fat
Oh yeah.
becomes swollen like that. It's like a balloon. You put inside a lot of water inside.
Yeah.
And then this cannula with suction power goes by nearby, and then it bursts, and then it goes into the cannula.
I see.
And now it's coming out.
Yeah.
Yeah, this is the technique that we use nowadays.
The two method.
Yeah, tumescent technique.
I see.
So there's not that much bleeding actually
These days.
Yeah, but after when this drug action ends, then it's time. All the blood vessels are open, and it starts bleeding.
I see.
Okay, so we need to do the special type of dressing so that you don't have a lot of bleeding.
Yeah.
After the surgery. So I let all my patients stay overnight in the hospital.
Okay.
So when you are in the morning, you don't have much bruises.
Okay.
About 90% of patients don't have bruises. My patients.
Yeah.
This is not regular.
All patients. Your patients. Yeah.
Yeah, my patients.
Yeah, because you have a chamber, right? Like a healing chamber or something where they.
Oh, hyperbaric oxygen chamber.
Hyperbaric chamber. Yeah, that's right.
Yeah, that's good for wound healing.
Okay.
And it's like you have better. I mean, you heal faster, and then the swelling goes away faster because the pressure is higher compared to the room air. So it compresses. So the swelling goes away faster. Yeah, you heal faster, much faster.
Okay.
So the recovery is much faster if you
see.
stay. And if you come to the clinic often.
Yeah. So I'm curious. In general, not just your clinic specifically, but in general, is the recovery period longer for liposuction, and how long does it take to recover from a liposuction compared to, let's say, a rhinoplasty or a blepharoplasty?
Usually, when we suture something on the face, we do the stitch out after 7 days. 5 to 7 days. When we do it on the body, we take it out after about 10 to 14 days after. So it heals more slowly. But when the patients come from abroad, I check after 7 days, and then if it's okay, I let them go home.
Okay.
Yeah. So when you go home, just wear the pressure garment and then do some massages yourself.
I see.
And then you just wait.
Yeah, that's all you
and
can
then
do.
you are Superman.
Wait. How long does it take for the final product usually?
We tell them to wait until for about 3 months.
3 months. I see. And is liposuction? Let's take all of the available plastic surgery procedures that you have, just like the most popular. Let's say breast augmentation, rhinoplasty, hair transplant, liposuction. Which one is which one is comparatively the safest, and which one would you say is regarded as one of the more dangerous or riskier procedures?
Actually, the most riskier. I think it depends on who's performing the surgery.
Right. Let's say all of them. There is a competent surgeon.
In United States, liposuction I think is number 2 most commonly performed surgery.
Oh, really? In the States?
In the States.
And what about Korea?
No, in Korea it's eyes.
Ah, of course, the double eyelid.
Yes,
I see.
People want to have double eyelid.
Okay.
Yeah, and want to make their eyes bigger.
Mm.
There are tens and more than 30 different kinds of surgeries for the eyelids.
Wow. So you can design the
No, it's
look.
not me. I don't do eye.
But
I don't do eye surgery.
It's available. Like you can, a doctor can design the eyes, right?
Yeah, yeah.
So there, just as you said that, it occurred to me that there is a very big difference in what the Western person wants to do when it comes to plastic surgery and what a Korean or an Asian person.
Yes.
What is your in your obviously experienced opinion? What do you feel like Asians want more, and what do Westerners want more?
I think Koreans are one of the most sensitive people and most difficult to do the surgery. That's why the Korean doctors are better. It's considered better. Yeah, because they complain a lot.
The Korean
people
patients?
complain a lot.
Okay.
They study a lot about plastic surgeries.
Okay.
And that's why it's difficult to do the surgery on them.
Anyway, so what I was asking is just the difference in the most desired procedures between Koreans and so Koreans want eye surgery. That is their most desired. And for Westerners,
breast augmentation and liposuction.
That's interesting. So
they want to have big boobs.
Yeah, they want
to have gravy.
Yeah, so they care more about their body,
right?
Whereas Koreans care more about their face.
Yeah.
Why do you think is that? What is that?
Korean women just want to have lean body.
Okay.
Yeah, it's not. But over the years, many people, the people's mind have changed.
Okay.
Nowadays, they want to have curvy body. There are a lot of people who want to have curvy body. So, like for the breast augmentation, before the people used to inject something like 250 cc per breast. They used to have just a small pack.
Mm-hmm. So 250 cc is small.
Yeah.
Okay.
Like the cup that mug cup, small mug cup.
Okay.
That's about 250.
Okay.
200 or 250.
Yeah.
So they that size.
Yeah.
Nowadays, nobody want that.
They want
a 320 and above.
Oh, really?
Yeah.
So would you say that there is for Westerners caring more about body and Koreans caring more about face, but now there's this change where they're starting to care more about their body as well. Do you think there is some part of that is due to Western cultural influence?
I think so. Yes.
Okay.
Yeah.
So perhaps media or movies or in social media?
Yes. But they also care about their weight.
Mm-hmm.
Usually, Korean women don't want to be heavier than 55.
50 to 55.
55. Yeah.
Right.
Yeah. That's it. But while in the people, my patients coming from the States,
yeah,
they're all above 60.
Oh, really?
Yeah.
The females, right?
Yeah.
That's interesting. So, why is that? Is it genetic or in your opinion?
Could be genetic, and then they want to have a little bit more fat on their body, but they want to just have curvy body.
I see. So the beauty standard in the West dictates having a curvier, bigger body is more beautiful. Where in Asia,
if you are 50 kilograms, you cannot have curvy body.
Yeah, there's not enough fat.
If you should be something like 5'1" or less than 5'4".
Yeah.
Otherwise, you cannot have that.
Yeah, because there's not enough muscle and fat, right?
Right.
Wow. So I always wonder, like, it's so interesting for me, the difference in beauty standards, like Koreans with the face, Westerners with the body. What about within the face? I spoke to someone just recently. They said, because I heard somebody compliment somebody's forehead.
Mm-hmm.
And I said, did you just say she has a nice round forehead? Because in my life, I never heard anybody say, nice forehead. You know, I was like, what is that? Because the first time I came to Korea, somebody on the street, they said to me, oh, very nice high nose. And I felt so shy. I thought they were insulting me. So I asked somebody called me a high nose. They're like, oh, no, that's a good thing. And it was the first thing in my life somebody said high nose, because I don't think that's something you say to someone in the West. And so yesterday or the day before, I heard somebody say, nice round forehead. So I'm like, is this the standard for Korean women to have a round forehead? And why? And why?
I think it's because of 관상.
Okay.
Yeah, 관상 means...
is it mine? Oh, that's 관상.
관상 is how you look on the face,
okay.
Which is good. Yeah, it comes from old times. Yeah, if you have this kind of eyes, it's good. You can earn a lot of money.
Oh, go like
or something.
Kwangsang, not the, like you're a face reader.
Yeah.
I see.
Yeah, so I think it's one of the reason is that yeah, if you have nice forehead, round, and the hair protruding a little bit,
So it has to come out a little bit. That's
yeah.
around for it is
That's
nice.
good. Yeah.
And there's a surgery or a procedure for that.
Oh yeah, we can put fat on the forehead, or we can put some filler on the forehead as well.
To make it a little bit
A
rounded.
little bit round.
Wow. Okay, so so they want that, and then what else? I guess. So a higher nose is better and more desirable.
Yeah. People want to have higher nose and more sharp nose.
Wow.
So you have a high nose, sharp.
Yeah.
A little bit tilted to the left.
It is tilted, and you know what's crazy? You know what is the crazy thing? I never knew it. I never knew it, and then
until you come here.
and then I moved to Korea, and I found out so quickly, and I realized I became so more conscious about my face also because I'm in this society. I mean, I've also had like very minor procedures done, but in my country, I never cared. I didn't even wear sunscreen. And then I moved here. I was like, oh my God, I've got wrinkles. I've had Botox done. So I started to care more. I mean, I think there are some good parts about it. But in some parts, sometimes I feel like even myself included, I become a little bit too critical of myself. And sometimes a little bit, what's the right word? A little bit superficial. Like I care too much about my look sometimes. Do you think there is a kind of a negative aspect about
Of course,
plastic
there are a
surgery?
lot of negative aspects, and there are positive aspects too. So if you are too much conscious about it, it's not good for you. But let's say you are 50 years old, looking like 60 years old. It's bad, right?
Yeah.
You get depressed. But when we change that person looking like 40 years old, she's very, very happy. And her confidence goes up like that. Her esteem, of course, how you look does not matter. Actually, you might think that way, but when you are looking at your mirror all the time, and you are 50 years old, but you feel you are very strong and still very healthy, and one of your friend will tell you, "Oh, you're not like the one I used to remember."
Yeah.
Then you get depressed.
You've changed. You've got some deep lines there.
Where's you?
Where'd my friend go?
Where did he go? Then you get depressed.
Yeah.
But that's why when we are here to make you look younger, 10 years younger. Yeah. So in that case, it helps a lot.
Yeah.
I had a patient. I remember a patient who was about 38 years old. She came to me with her mother and complaining about complaining about the fat at the lateral side of the thigh.
Yeah.
Actually, it was very big.
Okay.
Okay.
Like disproportional.
Yeah, very disproportional.
Okay.
It was very big like that. Like as if you have a hat on the lateral side.
Oh, wow. Okay.
And then she was not able to wear pants because of that. So she only wears a skirt wide like that, so to hide her lateral thighs.
Yeah.
She's been like that for 38 years.
Oh, so it's genetic. She was born that way. Much.
She was born like
her body
way.
deposits fat naturally here.
Yeah. So we did the liposuction. I can remember the next morning when we took out all the compression bandages. She was crying with her mother.
Yeah.
Both of them are crying. They're holding their hands and it's gone now.
Wow.
And then it was very touching. Yeah, because now she has a regular type.
Yeah.
And she was very happy.
I see. So I guess this is more of this is the positive side, the optimistic side of the good. How can I say the advantages of plastic surgery and the way it can change someone's life. But then on the flip side, people that already are just on the eye, good looking, attractive, have good bodies.
Yeah.
Sometimes these people want to get plastic surgery done, and you think to yourself, why? What? you're already here. How much more do you think you can level up in that? Even if you do get plastic surgery, will it change your self-esteem or your confidence?
You see, there are some people who are so greedy.
Yeah.
They already have a lot of money. They still want to earn more money.
Yeah.
Right? There are some people like that. So you are beautiful. You have really nice nose. And one day somebody says something bad about the nose.
Yeah.
And then she's conscious about it.
Mm.
And she goes to the plastic surgeon to have the surgery redone for the 4th time or 6th times, like that. Then this is not good in mind, and this is not healthy.
She's never gonna feel satisfied, right?
Right. That's the problem.
So it's something you have to
people.
fix inside as opposed to,
of course,
outside.
Yeah.
Because
being greedy is always problem.
Yeah, it doesn't matter what aspect of life. Because I've seen somebody that I knew years ago. I met them when they were 22, and I think they maybe just done their eyes, and they were very beautiful. And over the last 10 years, they have completely changed their appearance. I think they've done every type of surgery. I know they've done even the rhinoplasty 3 times. When before they had even done it once, the nose was really good. And I can just see the gradual change in the face going from this normal beauty to something that I don't recognize.
Very artificial.
Yeah, and
people can tell that you had surgery.
Oh yes, you even if you don't live in Korea, you can tell this person had surgery. And I think to myself, there must be inside of them a problem as opposed to not being satisfied with their appearance, or like you said, having an issue that they were born with. There is something inside of them that they need to fix, a self-esteem or a confidence issue. And I'm afraid that social media is purporting this, is building the momentum for humans to want to keep changing.
Yeah, there's this kind of social issues.
Yeah.
And actually it's not only if they are not shown there, still people who are greedy have some greed inside. Some people are greedy about money. Some people are greedy about they want to rule wherever they are.
With enough, they want power.
Yeah, they want to have power or something like that.
Yeah.
Somebody want to be recognized all the time. That's one of the type of greed that they have.
Yeah.
Some people want to have. They don't want to do anything.
Yeah.
I want you to do everything.
Yeah.
That's another kind of greed. And this kind of greed that people have who does a lot of surgeries are people who want to be recognized a lot. So they want recognition as beautiful. Yeah. And it doesn't end when you want to stop smoking.
Yeah.
If you are, it's very difficult, right?
Yeah.
Very difficult to quit smoking. But when you do that, we usually say to not to do something is very difficult. So how do you stop? You have to think about something else. So this is a positive way to convert a person to have less greed in certain portion.
Yeah.
So if this person who has a lot of greed being recognized or something like that, if they look if they change their mind into a positive way, maybe they want to sacrifice on something. Sacrifice does not mean that you are acting like Jesus. You go on the cross and then die there.
Yeah.
It's not something big like that.
Yeah.
Sacrifice, like when I say, "Oh, are you thirsty? I give you a water."
Yeah.
This is a sacrifice because you can think of a small sacrifice.
Yeah.
You buy a water and then give to somebody who needs it. And then I see you being happy, being satisfied. I'm very happy. This is stronger. If this is stronger than having the recognition type, then you can become more healthy.
So it's more about changing your mindset and accepting who you are and trying to give more than you get. Is that correct?
So if stop looking, if you tell the person Stop looking at the social media. Don't look at the Instagram or something like that. She can't.
Yeah, it won't work.
It doesn't work.
Never.
Never works.
Yeah.
You have to change.
Their mindset.
Yeah.
Has anybody ever come to the clinic and asked you to do a procedure and you said, no, I can't do this. This is crazy. I can't do
say that.
Oh, really?
Yeah.
In what circumstance will you say that?
People who are very, very thin
Mm-hmm.
has nothing to lose actually, and nothing to take out.
Yeah.
But still want to do the liposuction.
So they're already like 55 kilograms or something like that?
No. 55 is fat.
Oh.
43.
What?
Yeah.
And they come and they say, give me lipo. Where?
That's the problem. But the real thing is that if I do the surgery, I can do it.
Yeah.
I can make it small changes
Without
any complications.
Yeah.
Because I do very meticulously. I know how to do that without visible scars.
Yeah.
We can do that. But if I say sometimes if I say you don't need it, I of course I start you don't need it.
Yeah.
But if you definitely need, she comes 2 or 3 times and then asks me to do it. Then I do it, but without making any complication. I have many actresses coming, and they are very super. They're already beautiful, and they have nice body, and still want to have perfect. They want to have perfection, which is difficult to achieve. Actually,
it's impossible. It's impossible because nobody's. You cannot guarantee that everyone will always look at you and say she's perfect. Even if you think you're perfect, if there's 100 people, 99 think you're perfect, one person might think, not perfect. So you can never be perfect,
Yeah. Well, they want to. They're like. I asked her, why do you still want to do the liposuction? You're almost perfect. Of course, not 100%, but about 98%.
Yeah.
And you're so good. And then she says, I need to work harder to stay at where she is right now.
Ah, I see.
Yeah.
So it's not that even she wants to get it, it's that her job demands it.
Yeah.
Because I'm an actor, I'm in the industry. Luckily, I am thankful sometimes that I'm not a man, that I'm not a woman, because I feel like they're held to a different standard. Whereas men, you can age a little bit and you're still capable of getting good roles. Do you think that the pressure from especially Korean society maybe sometimes forces women to have to get surgery when they don't even want to?
If you're an actress, maybe, but if not, you don't need it. But but people who are regular person, but still think like an actress.
Yeah.
So
Yeah, exactly.
I think that's the problem actually. Yeah, they're not actresses, but they think like an actress.
Yeah.
So that's the problem actually.
Right. I mean, how many people, just normal people, come, like foreigners or Koreans, come off the street and they want to get surgery done because they keep seeing this beautiful influencer or actress. They want to look like them, right?
Right.
Is this? I don't even think this is just Korean. I think this is global. People, they want to be more beautiful because of these standards that you see the actresses. But that's not real life because they don't always look like they do on the TV, right?
Right. So I sometimes ask, why do you want to have surgery?
What do they say?
Sometimes they say, I want to become more beautiful. You are already beautiful.
Yeah.
Outside you're beautiful, but inside I'm not sure.
Yeah. Yeah.
Because I just started talking with her.
Yeah.
I can't tell if she has nice personality or whatever. I don't know.
Yeah, right.
But I just tell her, I'm not sure about your inside. How do you think about your inside? Inside your mind. How much book do you read? I mean, how much do you help other people, or how do you stay while you are doing nothing or something like that? And then she goes, she only thinks about the
appearance.
Appearance. Yeah. That, don't you think that's a problem?
Yeah.
I ask them like that, and then they say, yes, I know it's a problem. I can't stop it.
Yeah.
There are many Chinese people coming to my clinic, and then there are many people like that.
I see. Do you feel like the the prevalence now of K-pop and K-dramas, K-movies, it's completely taken over the world, right? Even to as far as South Africa, where I'm from, where when I left 11 years ago, nobody knew about K-pop or BTS or Blackpink or the movies or dramas like Squid Game, nothing. Now my little cousin, my niece, she's 10. She loves Blackpink. She watched Squid Games. She's not supposed to, but and I'm like, everyone, like, they sell kimchi in the supermarket. In South Africa. I never thought I would see this day, right? So the cultural export, the influence is global, and I feel included in that is the Korean beauty standard. Do you feel like a lot of foreigners come to the clinic and they want to receive treatment to match the Korean beauty standard?
Yeah. If you look at the Caucasians or black ladies who are something like about 45 years old, or it's difficult for us, for me to recognize, to see. Of course, it says in the chart when she was born, so I know her age. But just looking at her, I can't tell.
Okay.
Yeah, I can't tell how old she is. Because she looks a little bit older than how usual Korean women are.
Yeah.
So that is how I see, but I think she thinks the same thing.
I see.
Yeah, because you see an actress in the Korean movie.
Yeah.
You come to know that she's 60 years old.
And you think, oh my God, she looks 40.
Yeah, she looks 40.
Yeah.
There are a lot of actresses like that. And they are surprised by that. And then she looks at the mirror and then she thinks something about it. She needs to do something about it.
Yeah. And then they don't go to their local doctors. They fly to Korea because Korea is the mecca for for global plastic surgery. So it didn't only create the problem, it also solved the problem. So why is Korea so special with plastic surgery? What make you touched on it earlier.
As I told you earlier, the Korean patients are very sensitive and makes a lot of complaints. Yeah. So the doctor has to think a lot to solve the problems.
Yeah.
So your technique goes upwards because you are more sensitive. You don't want, me personally, I don't want to hear anything from the patient which is negative.
Yeah, right. Yeah. So you have a very high standard.
Yeah,
very high standard.
Yeah. So I need to make up to something like this. Compared to Japanese doctors, the culture is different. So if you have a complication, and then you don't, in Japan, if you go to a sensei, a doctor in Japan, and then your surgery is finished, you have complaint, you don't say anything to the doctor. You just go to another doctor. So this doctor thinks
he did a good job.
Yeah, he did a good job, and then there's no complaint or anything whatsoever. However, in Korea, if you have a complaint, and a small complaint, they come here and then they say, and then sometimes nicely, sometimes they shout. So you have to be more meticulous. Yeah. This is why the Korean doctors become better.
Yeah. Could it also be because, as you said earlier, within a 2-kilometer radius, you have 700 clinics?
Right.
Is it also perhaps that the competition is just so fierce? And I know there are so many Korean doctors that go to university and then specialize in plastic surgery. I've heard that plastic surgeons do get paid higher in general compared to other medical specialities. So there's the competition factor, and then also the potential, higher salary. Or those also factors that influence the why Korea is so good?
Well, there are many other jobs where you can earn much more money besides being a doctor.
Yeah, of course.
You buy Bitcoin.
Yeah, I have some of those friends.
Or do stocks, or become a fund manager. I think you earn much more money becoming like that. Many people think that plastic surgeons earn a lot, but in our area where we do the surgery, I'm in Apgujeong.
Yeah.
And people who live, the doctors who are in the like Gwangju or Jeonju or Daegu. He's very famous there, and his kids grow up. So they want to study, send their kids to a school in Seoul. So they move to Seoul and then open a clinic here, spending a lot of money to make a clinic. And within 1 or 2 years, they are broke.
Why? What happens?
You're not competitive. There in that city, you are very good.
Yeah.
You come here, you're not. There are many doctors like that.
Yeah.
So we see a lot of clinics open and close, and open and close,
Yeah.
and another new one come here and go. Yeah.
So it's hard to survive.
It's very difficult to survive. So if a doctor is here within Gangnam area for past 10 years, 20 years, something like that, it means you're good already.
Yeah. But I mean, also that's great for the patients because of all the competition, it means that it just naturally drives down price.
Yes.
If you're just a general normal patient looking for a pretty standard procedure. So I think that's why when I first heard about, I used to think it cost like $20,000-$30,000 for like a breast augmentation. And then I found out in Korea, it's like $8,000-$9,000. And then when I searched in the United States, it is something like sometimes $40,000-$50,000. And now it started to make sense to me why so many Koreans have received plastic surgery, because it's just so much more accessible. Do you know what the number is of Koreans who have in their life had some kind of plastic surgery? Is it quite high?
It is very high. I think in some form, it depends on your income, but if you have up to about average income, I think almost everybody had done something.
Oh, wow.
Yeah, even small facials or have dermatologic treatments or something like that. If you include everything like that, I think about 90% of people have done something.
Yeah.
At least have some kind of a Botox injection or something.
Yeah, right.
Yeah.
And then in America, why is it so expensive in the States?
Oh, you charge high, but your patients still come, so you can.
So you've set the bar, and they're like, oh, they keep coming. I can just keep pushing it higher.
Yeah.
Is it also like, I guess
I want to increase the price too.
Make it higher. Yeah, but for you, I guess because you're like one of the very few specialists in your field, it's possible. But if you're just a normal rhinoplasty doctor, if you charge just a little bit too much, even with a lot of experience, people might just go somewhere else, right?
Right.
It's like if you want to shop at Gucci, but you don't have the money, you have to go to Mushinsa, or Uniqlo.
Yeah.
So it's just a variety.
Right.
That's very interesting. I'm always comparing, because I have had not plastic surgery. I've done hair transplant, right? And when I searched the cost in America, I think it was something like $20,000, $30,000, $40,000, and it blew my mind. Because in order to get plastic surgery, that would mean you should be very rich. Whereas in Korea, sometimes people I've heard this many times, this stereotype that a lot of girls for their 18th, 19th birthday, their parents will buy them double eyelid surgery. Is that true?
Yeah.
Wow.
If they want to.
Yeah.
But some people don't want to have double eyelids. They want to have single eyelid.
Okay.
They think it's more attractive. So it depends on how you think.
I see.
Yeah.
What is the standard these days?
No, it's not the standard, but depending on your face.
Okay.
There are some celebrities without double eyelids.
Yeah.
And looking beautiful. Yeah. So if you look like her, she's satisfied.
Yeah. If you look like the actress that you like, if she has monolid and you have monolid, you're like, okay, I don't need it.
Yeah,
I'm good.
Like Han Hae-jin, she doesn't have the double eyelid.
Yeah,
she looks very beautiful.
Yeah,
right?
Yeah, I do. But I mean, I always hear this like it's so globally assumed now that people agree Korean actresses are the most beautiful. Like everyone says they're. So I don't know if it's because of the proliferation of Korean media, but a lot of
Uh,
people
me,
really
I, th-
now say the Korean beauty standard is the top.
I think Korean actresses are very beautiful, but it's not only Korean actresses who
Yeah,
are
of
beautiful.
course.
Usually, all the actresses all over the world are beautiful.
Yeah, yeah,
I mean, the actresses in Japan are beautiful.
yeah,
Go to China, they are very
yeah.
beautiful. Yeah,
But
yeah.
I think not even the actresses. One good thing about social media that I've realized is there are just so many normal people, and I realized you don't have to glorify actresses and influence. Just your everyday people are just as beautiful. It's
Mm,
just they're not in the business of utilizing their appearance in order to earn money.
mm.
Because you know, to be a good actress, if you have a great actress who acts well and a great actress who acts well and is very beautiful, if you go for an audition, this is an advantage.
Oh, of
Yeah,
course, you're right.
yeah. So there definitely is that advantage, I guess, in Korea, but in the West as well. But mostly not the face, just the body.
Uh-huh.
Yeah. I did also want to ask you about your daily life. So as a doctor, especially somebody who's a workaholic, what is your I wake up, this is my daily, and then I get home. What is that routine for you?
I live very simple life.
Mm-hmm.
I wake up, go to hospital, or go to church,
Yeah.
and spend my whole day in the hospital. Come to my home, eat my dinner
Yeah.
at around 8:30.
In the evening.
Yeah, in the evening.
Okay.
Because my clinic ends at 7.
Yeah.
So if it's traffic, it takes about an hour.
Yeah.
And I wait for the dinner. My wife cooks
Yeah.
or orders something
Okay.
outside and then eat. Then it becomes about 9 o'clock, 9:30. Then I sleep at about 10:30. If I sleep late, it's about 12 o'clock.
Yeah.
And then next morning.
Repeat.
Yeah, and then it repeats every day like that.
What about your
Weekend?
no, just your life in the clinic, like in the morning? Do you always have like your first hour where you're just like checking charts or reviewing patients, consultations, and then you go into surgery? What does that look like for you usually?
So I usually come to the clinic at 9 o'clock. So we have some meetings with this part and that part, like that.
Mm-hmm.
Or I go for exercise, and I do exercise about 2 or 3 times per week.
Okay.
Yeah. So
How old are you now?
57.
Yeah, you're still young.
Yeah, I'm still young.
Yeah, yeah, definitely.
Yeah. I plan to retire something like 70 years old.
Oh, so you love the work. You want to keep going, right?
Yeah. If I want to keep I want to work as long as I can. At 70 right now, I'm saying I'm going to stop at 70 years old, but I'm not sure if I'm if I'm sick or something like that. If I have knee pain or something like that, maybe I'll stop.
Yeah.
Otherwise, I want to continue.
What would you say to somebody who's just starting out their medical journey? They haven't chosen to be a plastic surgeon. They're just now like first year med student. But they're thinking about plastic surgery. Is there something? Would you advise them to actually do it, or would you say no, try something else?
It depends on why you want to become a surgeon.
What was it for you? What made you want to become a plastic
It
surgeon?
changed all the time.
Okay.
Yeah, at first I was thinking something else, like money wise.
Yeah.
But nowadays, no. Actually, I'm more committed as a Christian. So my devotion is to mission, and my clinic's name is Lydian. So Lydian comes from the lady in the Book of Acts, where you can see her who you can say the name Lydia,
Mhm.
and she earns money,
Mhm.
and she pays a lot of money for the mission of Paul.
Okay.
So with her mind, I thought I pay a lot of money to the missionaries that Korea sends out.
I see.
So I support a lot of missionaries.
So, I mean, in a
That's
sense,
my goal.
yeah. So, in a sense, the reason why you started is still the same, but the outcome is different. Like when you started, you wanted to be a plastic surgeon in order to earn a lot of money.
Yeah, for
You
me.
yeah, exactly. You
It
still
was
want to
for
earn the
me.
money, but now not for you.
Yeah, for me, I don't spend a lot of money. Actually,
I see.
Yeah, I don't drive a fancy car anymore. I used to,
Yeah.
but I don't. I don't ride a fancy car. I just ride taxi or something like that. I don't spend a lot of money buying clothes or something like that.
Yeah.
Yeah, even my wife doesn't. So my only focus is just to
Work to do.
help people, missionaries.
I see.
Yeah, and help the poor, something like that.
Yeah.
This is what I want to do. I also work for missionaries for North Korea.
Okay.
Yeah, we have a small community in our church,
Yeah.
and then we have people coming, students coming from the North Korea.
Yeah.
Who are here in South Korea.
Are they were they defectors
Yeah.
that escaped?
Mm-hmm.
Wow.
Yeah.
I'm very interested in these stories. These days, the last few months, I've been consuming a lot of content about some of these defectors, like how they defected, the means that they had to go through, the kind of just trauma and stress. It's so surreal, and it makes me realize how extremely fortunate I am just to live the life that I live.
Because in our community church, we have about we used to have about 15 college students and about 20 old aged people. Within our community. So I heard all their stories. All of them are different.
Yeah, yeah.
And some have very nice, easy way coming here. Some had very difficult times coming here.
Yeah.
So
the story I heard, this was crazy. So there was this North Korean student, and he was exceptionally good at math since a very young age. So every year since he was like 14, they would take him and 3 or 4 of his students. They would take them to like the international math competition. So they would go to Singapore, to Canada. I think they even went to South Africa in one of them. So then in his 18th year, he was approached by the government. Obviously not the government, because there is no government, but they approached him and they said, we want you to join the space program. Now, apparently in North Korea, if somebody says that the space program, means you're joining the nuclear program, right? So knowing that if you become a scientist for that program, you are completely monitored your entire life. You only do that, and there is no time for family or anything else. You're only in that area. There's like a compound, so you even live there. You cannot go out. You're just completely locked in for your whole life. So upon hearing that, the next year they had a math competition in Hong Kong, and he decided at that time he's gonna defect. Yeah. And so he told his dad, and his dad said, yeah, do it. And he gave him the little bit of money that he had. And even knowing that the regime might kill the family, right? His dad still said, still do it. So they went to Hong Kong. They finished the math competition, and then he laid in his bed and waited. So his plan was to go to the South Korean embassy, but he's not allowed to ask them for help outside of the embassy. So he didn't know where it was because he didn't have a phone or anything. So his plan was to wait for them to fall asleep. It was about 2 a.m. When they fell asleep, the only place he knew was to go to the airport. So he took a cab to the airport. When he got to the airport, he went to the Daehanhangong, the Korean Airways.
Uh-huh.
He said, I'm a North Korean, I want to defect.
Uh-huh.
So the lady was like, what? You want to defect? And she called someone. And that's when somebody from the South Korean embassy said, you have to come here. This is the address. But we cannot help you because it's in Hong Kong. So it's under their system. If they help, then it can be an international problem. So he had to get there by himself. So eventually he found a cab. He drove there, started to stress because apparently his math coach woke up. But then he got into the building in time. They opened the door and he had to wait there for like 4 weeks while the South Koreans were trying to arrange with the Hong Kong government to allow him to go outside of the embassy into the airport. So eventually he made it to South Korea.
That's a very difficult way because most of them just go to Thailand.
Right.
Yeah.
Because they don't have the treaty, right? It's easy to go from there to...
Most of them go to Thailand, and then from there they stay in the jail for about a month or so, and then they come to the South Korea.
Thailand, yeah.
But they have to go past through China.
Right, they have to go through China, right, exactly. Yeah, it's so interesting. When I heard that, I'm like, wow, and I was just born, sometimes I'm like, South Africa is not like America or Spain, it's not like first world. But I was very fortunate. So even the times I want to, feel sorry for myself, I realized, no, my life is great. I'm so fortunate and lucky. So those stories always remind me, to be humble.
Right.
Especially now with my life in Korea, I get to speak to, people like you. And there are a lot of these ethical problems you think about when you do this podcast. And so I guess it's the same as a doctor, right? Like, are there some kind of ethical things that you've realized being a doctor that you never thought about before when it comes to patients? Like, he's asking me or she's asking me to do this, or I don't think this is a moral situation. Or do you ever have like within yourself where you have to ask yourself like, is this the right situation as a person based in your job?
Yeah, sometimes like when an old man, when a young lady comes to me with an old man. She's 21 or 23, and she comes to me with 60 something, and he's not her father.
What's going on here?
Yeah, that's the time.
And is she asking for plastic surgery? She's asking for procedure.
He's paying. I can tell definitely he's not his father. He's not his aunt. I mean, whatsoever.
Uncle. Yeah. So in those situations, you say, "Sorry, I cannot."
No, I can't do that. I see a lot of Chinese girls coming like that, and and some were defectants from North Korea.
Oh,
yeah,
wow,
coming like that. I felt very sorry and very sad about the situation.
Do you feel like they're under duress, like they're being forced, or that they?
No, they're not forced because they cannot make money. I think that's the
so
that's
it's
one of the reasons.
A means for survival.
Yeah, in China, there are some problems like that. A young, beautiful woman usually dates old entrepreneurs, not old, 40-something, who has a lot of money.
Yeah.
So, and this is same kind of social problem in Japan as well. Here as well.
Yeah.
I'm sure it's all over the world.
I think it's definitely global. Do you think there is a misconception that people have about plastic surgeons? Like, is there some kind of misunderstanding the way people perceive plastic surgeons that you think, I wish people didn't think about us like this? Or even something positive where they think, plastic surgeons are like this, but they're not.
I think some people might think that surgeon's life is like very they earn a lot of money and they live a life of
Glamour,
glamour
luxury.
and luxury and something like that.
Yeah.
No, usually who earn a lot of money
Yeah.
don't have time to spend money.
I see.
Yeah, because sometimes young doctors, as I can see in big hospitals, they do the surgery until like 2 or 3 in the morning.
Yeah.
Yeah, and then they wake up, especially during the nowadays, because this is the time of winter vacation.
Yeah.
So of the high school or college.
Yeah.
So this is the peak time, and they work until 2 or 3 a.m.
And if they're not performing surgery, if they're like very high up, then they're in charge of the staff, right? They need to be overseeing the hospitals.
Mhm.
So it's never ending.
Never ending. Yeah, your life is not that uh, relaxing and luxurious. No,
Yeah.
no, it's not.
Yeah. Just
The doctor per se, I don't. You don't have you don't have a lot of time.
yeah. So you have to really love your job, otherwise it feels like it.
Yes.
Otherwise, just
Mhm.
do you feel like that sometimes? Like, I don't want to do this anymore. Like, I'm kind of tired of it now.
You know, from the time that I became a doctor, I never had a vacation longer than 12 days.
In your whole life,
Yeah.
12 days.
Uh-huh.
That's crazy. Because I have that like twice, 3 times a year, like around that 12, maybe 14. Yeah, well, 12 days. But yeah, but I mean, you could if you wanted to, right? If you wanted, you could probably quit now and you would be okay.
Oh, it's difficult because I have 22 employees.
Yes.
Yeah, I need to pay the rent. I need to pay the wages and everything.
So you're
Yeah.
responsible for other people. I guess that adds a whole different complexity, a different burden.
Yeah. If I'm a salary man,
Yeah.
it's different.
Yeah, you can just
I can just quit and then stop and then go somewhere else. Maybe have a vacation for about a month or 2,
and then maybe
something.
come back, find another job.
Right. But I'm also an entrepreneur, so I need to keep this business going.
Yeah.
I can't go anywhere.
You're the 가장?
Yeah.
Yeah. You're the head of the show.
I was counting how many jang I am.
Yeah.
10, including 가장, which is the family leader of the family.
Oh yeah, there's 가장, 원장.
가장, 원장,
Yeah.
사장.
Oh yeah, you're all the jangs. What is your song? Your family name? You're not
An.
An, yeah, that's why you're Dr. An, right? Yeah.
Yeah.
Have any patients ever regret, not your patients, but have you seen patients like regret getting their surgery? Like they did it and they're like, no, I don't want this is
Of
crazy.
course, there are very few people who are like
But
that.
not your patient, just in general. Do you think
Yeah.
the satisfaction level is quite high?
Depends on what kind of surgery you have received.
Mm.
And some people, nothing can be satisfying.
They're gonna just get more.
Yeah.
Yeah.
That's the difficult part.
Right. Well, what I usually do with my guests is I ask them to impart one part of wisdom to me. It can be anything that you've learned throughout your life or your career that you can tell me that I can apply in my life. If there was just one short piece of advice that you could give me, what would you?
There are many things that I talk about, but for you, my father used to be a perfectionist. When I write something, when I was in high school, at that time we did not have computer yet, so I had to type.
Yeah.
Like that, and he reads it. He used to be a professor in English.
Yeah.
And he reads it, and he has this red pen, and then checks all the things which are wrong grammar and wrong spelling and everything, and I have to type it again.
Yeah. There's no autocorrect or backspace.
No backspace. The most interesting thing that I ever saw was electrical typewriter.
Okay.
Because you have backspace.
Oh, amazing.
Yeah, you can go backwards five letters.
Yeah.
That was incredible.
Yeah.
Because I had to use the white correction liquid.
Yeah.
You don't need it.
Yeah.
That was the most interesting thing that I have ever encountered in my whole life.
Yeah.
You know? But and then he reads 7 times. He told me you have to change. I mean, you have to rewrite at least 7 times to submit it to the teacher.
Yeah.
So I used to do that when I was in high school. You know, because my dad was a perfectionist, and that was very difficult thing. Then when he does something, it never ends. You know.
Yeah.
He keeps on doing it until he feels it's perfect, like an artist. You know? Like many artists are like that.
Yeah.
Whether you're a painter or a writer or you're a singer, you're not satisfied with your singing methods or something like that. And then our Gaon family words was to 최선을 다하자, meaning
try your best.
Yeah, try
always
your best.
do your best. Yeah.
Always do your best.
Yeah.
I changed it.
Okay.
You have to do it in time, within the time limit.
Okay.
Do your best within the time limit.
So do what you can with the time you have. Don't take more time than you need because you can never.
If the deadline is tomorrow,
Mhm.
you do it until tomorrow.
And then after you
After
forget
it's
about it.
finished,
I
you do your
see.
best until tomorrow.
Okay.
Because if not, you have to
You're
keep
gonna
on
keep
doing
going.
it. Yeah, until it becomes when you feel like it's perfect. You have
Yeah.
to do. You have to keep on repeating it and everything, which
Yeah.
is useless thing. I don't want that.
Yeah.
So I changed the family wisdom in my family.
Yeah.
do your best
Within the time.
within the time that given.
Thank you. All right, thank you, doctor. I'll take that to heart. Yeah, it's been a pleasure having you. I'm sure in future we will have many more conversations.
Okay.
Yeah, thank you so much.
It was a very nice time to have.
Thank you.
Okay.
Perfect. Congratulations, you've made it to the end of another podcast. If you're interested in consuming another one, check this one with Alex Carlson, a K-pop producer. There we go.